Yeah, hi everybody. This is just the last. This is 5 minutes worth of stuff at the very end of chapter 26. Uh, Basically, just continuing to. I wanted to finish up on the because there's a few questions on this on the file. These are the sexually transmitted infections. We were dealing with chlamydia, and really, it's very similar for gonorrhea, trichomonas, many of these that end up with these particular problems, as you will see. But again, just a quick review. It's not as symptomatic as you would expect. That's why, other than maybe some drainage that someone might have a tendency to dismiss as minor irritation, there can be big problems. The issue of the newborn and the birth canal is very important. Again, mandatory antibiotics are used for every birth in the United States topically. And then, obviously, thankfully, this is treatable with antibiotics, typically because it's not a cell wall. It doesn't have a well defined cell wall. It has some peptidoglycan, but the cell wall is sketchy. You typically are utilizing something like Vibromycin or a Z-Pak as opposed to a cell wall antibiotic like a cephalosporin or a penicillin. Okay. Very similar, more common, arguably the most common, certainly the most common protozoan infection in this country. From my studies, there's a big three. It starts with HPV, with people who have been affected, either new cases or ongoing cases, because once somebody gets human papillomavirus or herpes, they have it forever, but then you have breakouts. Trichomonas, which you can treat with basically antimicrobial agents, as I'll tell you about in a sec. More new cases outbreak every year than any other disease. This is a parasitic infection. It's a drainage disorder. It's very much like gonorrhea. It's very much like chlamydia. Okay, except it's a parasite. It's much more common in women than in men. When they talk about easily and inexpensively treated, that's absolutely true. We use metronidazole, known as Flagyl. Whether you learned about it or not in micro, I don't know. It's an anti-parasitic agent that's also an antibiotic, so it's the drug of choice if you're familiar with an agent called C. diff, Clostridium difficile, which is just rampant in hospitals associated with antibiotic-induced diarrhea because the broad-spectrum, powerful antibiotics kill the good bacteria, and this flourishes, and about a fair percentage of us have it. It's a endospore. Clostridium is like tetanus or botulism. In this case, it produces a nasty toxin. I've had it. You don't want it. Okay. Moving on. And again, the problem with this is it's a drainage disorder, and a lot of times it's asymptomatic. And what happens ultimately, it's a plumbing problem, just like chlamydia, just like gonorrhea. If it doesn't have a pathway out, it goes up. And in this case, you're going once it passes through the uterine, once it gets into the tubal area, once you get into the tubes, the ovaries, you have ectopic pregnancies. You have something called pelvic inflammatory disease. It can lead to ectopic pregnancies, and it can lead to ovarian dysfunction. It can lead to early onset hysterectomies because it's an open system. It can get into the abdominal pelvic cavity, and this is the difference, the discharge, and that's because it's not something you would want to necessarily dismiss. What's interesting, it's very easy to get a smear. You take a swab, put it on, fix it on top of a slide, and look at it microscopically, and basically, because I typically spray fix them, and you'll get a fluid under, and you can see something. You probably under standard high power, not oil, because this is a eukaryotic cell, is you're looking at this twitchy motif. It's twitchy. It's a flagellant. We classify protozoans based on how they move around, and this moves around with flagella. And the flagella attach inside the urinary tract or the genitourinary tract, and bad things happen. It can happen in men as well, but again, the treatment is relatively easy. For a long time, it was a slam dunk. We didn't have a lot of antibiotics to treat people with. So, I mean, the default, if you weren't allergic to penicillin, was they gave you, uh, for all of these things, they gave you ampicillin, figuring it was because they thought it was all gonorrhea and hope it went away. And fortunately, most of the cases responded as long as people restrained from making the problem recur. But now we have more specific antibiosis, and now this is not antibiosis, this is the antiprotozoan. And again, it's a very fortunate to have this. There are other antiprotozoans. This is It's been around forever. It has the side effect package is very limited, maybe a headache more than anything else. It's used extensively in other things. It's used in something called bacterial vaginosis that you might have learned about, which is because it's an anaerobic metabolism. Bacteria is the suspected culprit, though we don't know, but it is efficient. It works again. It works very well on C. diff and other so it's the default for anaerobic metabolism, and a lot of these that's really helpful. And it's the kind of thing we see particularly with contaminated water and well water, giardiasis or amoeba. If you notice, if you live in more rural areas and you have well water, this is an ongoing problem. It's actually because well water gets contaminated more easily than you think. This it's one, it's making a comeback. Two, when I started in medicine 50 years ago, this was everywhere. We classified these either you had gonorrheal urethritis or you had non-gonorrheal. And gonorrhea hurts. I don't care what any of these people say. It is absolutely painful. That is the stupidest thing I have ever heard or seen. I mean, it is much more so in men, much less so in women, but still hurts. The discharge is startling. It's typically yellow. It's typically pus. And if you're not suspecting there's something wrong, you've got a problem. And again, all of those apply, except this is particularly nasty because once it gets into, it has lots of ways to avoid your immune system. And it does so much damage, it relatively easily with damage can get into the bloodstream. And when it gets in the bloodstream, it can go anywhere. You may remember me from saying this when we talked about arthritis and advanced anatomy. If other than a child shows up with septic arthritis without a history of trauma, it's not like I fell and got a big cut on my knee, or I felt something puncture into that knee area. And all of a sudden, pus is coming out of that joint. It is gonorrhea until proven otherwise. Period. End of sentence. It has a predilection for that area, but in the bloodstream, it can attach anywhere. And depending on the kind of sexual contact, it can go anywhere. It's the reason they use silver nitrate drops, which I told you about previously, until we had better topical antibiotics to use after the birth process to be able to treat these things, except to turn the skin blind. But it was all about gonorrhea. It was causing blindness everywhere. It is just it's very distinctive. And all of these things are just horrible. It's very inflammatory. It has little pili, little fimbriae. You might remember your bacterial anatomy. They just latch onto everything and latch it. I mean, I've listened to some interesting lectures about this where it's been in some very unusual places. Again, just depending on the kind of intimate contact people prefer. So all of these things that are there, you can read through it. We saw cases daily about this, and they were, and by this time, when you have a pelvic implant, an internal exam, a pelvic exam that produces acute pain, that's big trouble. And we were constantly giving this, and and we'd see them back in 3 to 6 months. We're going to understand the population we were dealing with. This is a little bit different. And it used to be very easy to treat with because it's such a fastidious bacteria. It's very hard to grow. You need special agar. It's difficult at best. You even used to have agar with other antibiotics that'll get rid of problematic. It's got a fancy name. It's called Theramartin. But the reality is we're seeing increased resistance. So now you're doing combination therapy with cephalosporins and other agents. And that's what I'm showing you, 2 antibiotics now. So maybe you're using cephalosporins and a Z-Pack. You're not taking any chances with this. Okay, because we're starting to see it in the what I would call from the HIV, the onset of the HIV era. This really took a hit from a standpoint of, thankfully, how many cases there were. But now we're seeing it's like the out of sight, out of mind thing. People are getting a little less careful. Once they ascertain that their partner doesn't have HIV or doesn't have hepatitis C, then all of a sudden those protective and barrier they're starting to take a backseat, and we're starting to see it's not like it disappeared. And this one, to me, is a lot more damaging and a lot more painful. That's probably why it disappeared. Not disappeared, but why the frequency, the prevalence of it, the new case levels dropped because there was a lot of attention paid to that. Because people were really having problems. Same can be true about syphilis. Syphilis has been around forever. Gonorrhea has been around forever. This is different. This is an ulcerative disorder being causes a sore. And the good thing about sores is they tell you something. I mean, but people have an alarming tendency to A, ignore them, or B, not see them. And I'm not saying that in an obvious place on the penis, you wouldn't be able to see it. But in the female, a lot of these what they call chancres or cankers, CHANCRE, known as a hard chancre, which is not painful, is a sore that develops on the genitalia, the external genitalia, which are difficult to see, obviously, in the female, and depending on their location, might be less visible in the male, not getting overly graphic. And I mean, just that sentence alone should give you an idea. There was, I never saw them years and years ago until they started to get a handle on this. This was such a leading cause of death, congenital syphilis. You had when it was passed on to the unborn child and it crosses the placental barrier, notched teeth, pupillar. It's called Hutchinson's triad. Hutchinson's pupil is like an irregularly shaped pupil that even people get in late stage syphilis, but babies get it. Hard tissues like teeth and bones were significantly affected. You have defective defects without, in the vascular system and in the brain. Also, so Hutchinson's teeth have little notches in them. You can look up the congenital syphilis and just make yourself sick if you want to. And so it's very, very easy. It doesn't take much for this to be invasive. The sores are teeming with spirochetes. It's a and it's like Lyme disease. That's a gram-negative spirochete. What's causing the problem is your immune system. We just had a presentation about systemic lupus erythematosus. We call it a great masquerader. Mononucleosis is a great masquerader. Syphilis is a great masquerader. You get after that initial sore disappears, and it takes a couple weeks to show up, and a couple weeks it goes away, and people think they're better. The reality is they're still highly contagious. The difference is, other than having spirochetes teeming out of the sore and being very contagious, now they're in your bloodstream and you're very contagious. And they're getting into your secretions and you're very contagious. So genitourinary secretions, saliva, you name it. And that's called secondary. And that's now we have this second stage where it is you're highly contagious. It's spreading throughout your system, and all the damage is immunological, swollen glands, rashes, sore throat, fever, feeling lousy. And again, the trouble is it goes away. And after maybe, 3 weeks, 6 weeks, and people mistakenly think, oh, I just had the worst case of the flu. I had some viral bug. Oh, I'm so sick. I'm better. The reality is now it's entered a stage maybe in two-thirds of the people call latency. Some people it actually has gone away, but that's rarer than you think. And at that point, that latency period can last for years. And I'm not talking a year. I'm talking 2 years, 10 years, 20 years, 30 years. It is still treatable maybe halfway through latency. Once you get past about the halfway point, now you're going to, it may never do anything, but the reality is most likely it's going to proceed on to tertiary syphilis, which is extraordinarily damaging again. Hard tissues, vascular disorders, neurological disorders, degeneration of literally pieces, almost like leprosy, little pieces on the acral areas, parts of the nose and ears are syphilitic lesions. They're all over. And the reality is, it is a comparatively, even though it's getting a little more resistant to penicillin, you can't grow this in culture. It's the most fastidious of all the bacteria in the sense that you can't grow it in the lab. We identify it by indirect means, by fluorescent antibody tests, by it's almost like look-alike type of substance to see if you're developing antibodies to it. It's been around for a long time, and I don't recall if I told you, but I think so. I mean, we were all tested for syphilis up until when we were going to get married. Not to stop from getting married. That was when I got first married. I was 78. And everybody had to have a blood test, and there was a 3-day period until they analyzed the results. And they just said, because they want If you didn't have, if they were negative, you're fine, and if you're positive, that's up to you whether you want to continue to get married to somebody. But that was an opportunity for the health department to try to get this under control, and for public health officials to talk to you and get your contacts, et cetera, et cetera. That's what happened. I mean, and again, there were, other than West Virginia and Nevada, those were the quickie states to get married because it was a state law at the vast majority of states. And I don't know when it stopped, but it stopped. But here, the Shanker, which is painless, it's called a hard Shanker or Canker. I call it a Shanker, but everybody has a different name, pronouncing. And then weeks later, all of these things disappears. Then it's latency, then it's tertiary. These are these areas that break down all over. Sometimes they're visible if they're in the skin. It's almost like you could push your finger through the skin into deeper structures, and they were just so much. And again, we're still looking at penicillins, but I think we're a little more sophisticated. Two more. And again, these are where you have a visible lesion. This is in this kind of the HPV. We're not talking about all warts are human papillomavirus. Doesn't matter. A wart on the bottom of your foot, on your hand, on your skin someplace. That's human papillomavirus. It is a tumor. It's a virus that causes a tumor that's in, if you might remember, the stratum granulosum of your skin, if you go back to the anatomy. It is certainly the most common based on people infected, because once you're infected, you have it, and new infections. And the presumption is anybody is sexually active. This just gives you the number. Over half the adults are infected during their lifetime. This is statistics from roughly 10 years ago. Call which one? Okay. This is the ones we know certain types, and they type viruses by number in this case. And they are the ones that are identified as being most likely to cause certain problems. And when they talk about Gardasil and the other types of immunizations, they focus on certain types that are most likely, and they've been very successful. So genital warts, they can present very ugly, difficult to see, again, internal in the female, external in the male. In the male, they can block the urethra. In the female, they can cause blockages. In the anal area, they can cause blockages. And again, they're spread because of sexual contact. Invasives, 80% of invasive cervical cancers are linked to these strains. And again, and the area that's rising the fastest is right there, oropharyngeal. There was just a big article in I don't know if if it was on one of the news sites or if it was on one of the New York newspapers. The startling number, and it's not just because it's New York. This has been around for a long time. It is these are genital warts, and again, just like any virus, they don't. It's not. They're not limited anatomically, and depending again on what type of sexual contact people prefer, we're seeing a vast increase. And the only difference is their death rate is considerably smaller in the sense that HPV has unfortunately in the female has a troubling death rate. Though I'm not familiar with the numbers now. Statistically, this is not as big of a killer. It's certainly very damaging. You have to go into significant amount of treatment. The treatment is certainly life altering, but it's less fatal. And again, this is again, it's not just girls. That's the most common misunderstanding. It's boys as well. The skin and tissue in the external genitalia in the male, very, very similar, very moist and soft compared to regular skin, for lack of a better way to describe it. And herpes, just as, again, oral and genital herpes, which are two different types, can trade places anytime, again, depending on the type of contact people indulge in. The ones that are more painful and more problematic are we classify as HSV, herpes simplex virus 2. Okay, very controlled because it's not obvious. They're tiny blisters. If anything, they're the least problematic of all of these, other than the initial case, which burn and are more irritating. They're really not that noticeable. And the trouble with HPV and a lot of these, you're infected as they're developing and contagious. You're infected when they're there, and you're infected when they're going away. I mean, contagious for all of those types of things. And unfortunately, some people get it once and it never flares again. Thankfully, we have very good treatment with the acyclovir family like Valtrex. It's, in my opinion, the best of the antivirals. This is the real bad one, particularly in the first attack in people who have not had satisfactory treatment or prenatal care. This it can be it's frequently deadly is a better way to express it. You can get a herpetic encephalitis as the baby passes through the birth canal. These babies, if it's not been treated, they have to be identified. And if you have the luxury of time to be able to take these by C-section and deliver the babies that way. Malformations, you look up the pictures on neonatal herpes and you don't want to see them again. And so, and all of this, and there's a lot of success. Again, there's no such thing as an antiviral antibiotic. Antivirals only work once you get the virus. They prevent recurrences sometimes, and herpes. They can make recurrences less severe. They cannot prevent it. Well, take this Valtrex because you don't have it and I do. It doesn't work that way. They own Valtrex, if you did not know, any of these acyclovirs only become active once they enter a cell that has the virus. There's a genetic aspect of the virus that activates the antiviral. And that's why it's such a good antiviral agent. And we end. If I think of anything else as I review the exam, I will certainly send it to you. I'm thinking of sending you that. If I can find that growth and development lecture, I probably have it. And I'd rather have to restate because it's not on the exam, but I think you find it interesting and useful going forward. Thank you. Let me get this out of here. Glad we had a chance to do this morning. It's Tuesday, not quite 8 o'clock on April 28th.